we had our interpretation. We discussed this one and a half days. We discussed many areas of interpretation. It is about the injuries, but other all these things, most of these discussed. And we had three training sessions. The USA, Indians and economy, Indians and climate change, community participation, public-private partnership, social mobilization, marketing. And we had 9 symposia. Those are road safety, drowning safety, poisoning safety, animal safety, occupational safety, child safety, elderly safety, data management, post-trauma care. We had 9 symposia, those 9 areas. We had 6 free paper sessions selected from the abstracts we got from various parts of the country, and we had actually we selected number of papers to be presented at the conference. Out of those things, finally, actually, after going through all these sessions, we found that the conference emphasized the importance of interventions by policymakers to better prevention of injuries across the country. We wanted to highlight that one because in each and every session, we got to know that most of the speakers and also the audience, they emphasize about the importance of policies and how to implement all these policies related to integration. At the moment, we have policies, acts, regulations, but the problem is, to some extent, it is that the practicability is not there for all these. Therefore, these are the things that we need to emphasize and future directions. But we have to think about when we consider the interpretation program in Sri Lanka. And I would like, if you have any suggestions, what mechanisms we can have to solve this problem, because even though we have policies by the policymakers for the better prevention of injuries across country, how can we utilize the policies and what is the role of policymakers in implementing all these things. Therefore, I think I'm not going to ask the questions from the audience to get some answers, and if you can share your ideas with us, I think it would be much better to streamline our program. The other one is the conference, that many areas emphasize the importance of multi-sectoral involvement. And final session also was on multi-sectoral involvement, public-private partnership, and social marketing and so on. One question is also raised about the mapping of sectors. Actually, to give some kind of answer for that one, when we were developing our multi-sectoral action plan on injury prevention, we tried to identify the relevant stakeholders. Actually, we mapped those to identify the different activities, different roles of the different sectors. Injury prevention for me is not a simple area, because it's a vast area, and injury is very considered in our injury surveillance also. We identify different injuries, like starting from road traffic accidents, poisoning, animal bites, animal attacks, birds, fire-related injuries, poisoning, drowning, and those things are, and falls, those are very common in Sri Lanka, and we have identified different types of injuries. Therefore, stakeholders involved in these, for the prevention or who are dealing with these things are also different. Therefore, it's not a simple activity, simple exercise to identify the roles, but for some extent we identify. But the thing is, how can we engage, even though we identify these different sectors, how can we engage with them? How can we coordinate with other sectors for the prevention of injuries in Sri Lanka? That is another area that we have to look into. The other one is that at least the conference emphasized the importance of having better idea of the cost associated with trauma, mainly its management. And to avoid this problem, we need to find out some ways, because then only we can have some kind of idea about the burden of it, burden by not by numbers, but by financially. What is the burden of injuries in Sri Lanka financially? Because we know that not only for the management, treatment of injuries, many out-of-pocket expenditure is much higher than that. And sometimes we know that medical cost is also some billions. Therefore, we need to identify the cost of this for the management and the cost for the injuries. Therefore, if we can reduce that one, we can utilize that money for other essential things. I think for me, I think almost all of you may agree with me. Injuries can be prevented if we take little attention and little precautions. Each and every injury can be prevented. But the problem is we want to change our attitudes and behavior. We have knowledge, but we need to change our attitudes and behavior. Then only we can prevent all these injuries. Finally, in terms of injury prevention, the importance of data is also emphasized. Because now data, we collect so many data-related injuries. Now injury surveillance is one hand, and Sri Lanka police and other researchers also collect some data. Therefore, we want to integrate all these things to see the correct picture of injuries. Therefore, in terms of injury prevention, the importance of data is emphasized. Furthermore, data or injuries are collected by different sectors and do not appear to be integrated. Therefore, it's very difficult to see, get some a better idea of injuries, the burden of injuries, pattern of injuries. Therefore, after this conference, highlighted these things to be identified, to be considered in future directions to future to find when we are planning our integration program. Therefore, I must thank because we wanted to have a small panel discussion on this one, but because of the time constraints, we are not going for that panel discussion. Therefore, we would like to hear you about all these main 4 problems. That is, what are the policies? How can the policymakers involved in implementing these programs, interpretation programs in Sri Lanka? The other one is how can we involve the multisectoral involvement, coordination? Because even though there are so many people are working on injuries prevention, how can we engage with them? The other one is costing. How can we know the financial expenditure or the financial problems of this one? And finally, importance of data research. How can we improve the data systems and the knowledge on injuries through data by improving the data systems and also the research. Those are 3 things that highlighted as in summary, 2 of the conference. I think those steps we will have to consider all these when we are planning in our future elections. Therefore, I must again thank you very much for all of you. It is not the vote of them, but I must thank all of you. If you can share your ideas on these 4 areas, because then only we can have a better idea and have a better idea about the prevention of injuries in Sri Lanka. Thank you very much.